Hi ma'am, sir. I am Rivera and this is my younger brother and I will be performing the head and neck assessment. Inspect the hair, size, shape, and configuration. Next, we're gonna palpate the hair and take note of the texture of the hair. And this time we're gonna wear gloves. Now I have worn the gloves. Now we can examine the hair and look for the texture. And examine the scalp if there is any lumps or lesions, and examine for the presence of any infection or any parasites. You can clear some of the hair to look onto the hairlines if you can see any presence of infections or parasites. And I can see none, so this is good. Now I'm gonna take off my gloves and examine the skull. Now we're gonna examine the skull. We're gonna look for size, shape, contour, and symmetry. We can see that the head and the size of the head is normal. Now I'm gonna examine the skull and look for any depressions, nodules, and I'm gonna start from frontal to occipital. We're just gonna look if there's any depressions or nodules or any abnormalities on the skull. And I can feel none, so we're good. We're gonna examine the face. We're gonna observe the facial features if there is any drooping or asymmetrical features of the face. Now we're gonna take note of the facial symmetry and facial movements. Now I'm gonna ask the client to smile for me. Can you smile for me? Can you frown? Can you puff your cheeks? Can you wrinkle your forehead? And everything is good. And next we're gonna assess the eyes, the external features of it. First we're gonna inspect the eyebrows. If there is even distribution of hair, the alignment or unnecessary movements. Second is inspect the upper and lower eyelids while the client's eyes are closed. So could you close your eyes for me? And then inspect the bulbar and palpebral conjunctiva for color, texture, and presence of any lesions. So close your eyes. And I can see none, so we're good. And next we're gonna inspect the eyes if there is any asymmetrical features and look for it. If there is any red colorness or yellow, but there is none, so it is good. Next we're gonna inspect the eyes if there is any asymmetrical features again into the eyes, and there is none, so we're good. Next we're gonna inspect the areas around the lacrimal glands for any tenderness. Second is palpate the nasolacrimal duct to assess for blockages. Next is palpate the inside of lower orbital rim with the tip of the index finger near the inner canthus of the eyes. We're gonna test the corneal light reflex by holding a pen light approximately 12 inches from the client's face. Shine the light towards the bridge of the nose while the client stares forward. Now we're gonna ask the client to stare forward and look to the distant object, then cover one of the eyes with an opaque card. So can you look straight forward? Now I'm gonna observe the movement of the eye, and it is normal, so it's good. Now I'm gonna inspect the cornea and lens of the eye, and I will look through the pupil while shining a light on it. And I'm gonna shine the light on this side of the eye with an oblique view. So inspect the shape and color of the pupil, measure the size and symmetry of the pupil. And it seems normal, so I'm gonna head to the next step. Next, I'm gonna test the accommodation of the pupil while holding my finger for about 10 centimeters from the client. And I'm gonna ask the client to focus on my finger and while moving the object closer to the eyes. Now please focus on my finger, and I'm gonna move closer to the eye. And now I'm gonna ask the client to cover his right eye and look directly at his nose. Please cover your right eye and look directly at your nose. Okay. With an extended arm, I will hold the object and move it onto the peripheral visual fields of the client. And I'm gonna ask the client to note where moving object was first seen.
I see it.
Then next, cover one of the eyes and then observe the movement of the uncovered eye while client is looking fixedly first the near, then the far or distant object. So please cover one of your eye, then first look near, then far. Now I'm gonna test the 6 primary eye movements. So first, focus onto the object, and then follow it. And we're done. And now I'm gonna place the client 20 feet from the Snellen's chart, and then I will ask him to read until he cannot read the letters anymore. Now, can you read the Snellen chart for me?
E, F, P.
And now I'm gonna ask the client to read a book and then assess his near vision. So please read the book for me.
Cell division is associated with growth and development.
I'm now gonna assess the nose. So first, inspect the external nose for shape, flaring, discharges, and other characteristics. And I see none. Next is, I'm gonna palpate the external nose for tenderness, mass, or dislocation of the bones and cartilages. And that feels normal. Next is, I'm gonna check the patency of the nostrils. And I'm gonna ask the client to breathe in other nostril and repeat the same procedure to the other nostrils. Please breathe. Please breathe. Okay. Next is, I'm gonna tip the client's head back. And then I'm gonna inspect the nose for edema, inflammation, excessive drainage, redness, swelling, and growth with the use of pen light. And then I'm gonna inspect the nose separately. Everything looks normal. We can proceed to the next step. Next is I'm gonna palpate the frontal and maxillary sinuses to detect any structural abnormalities. So first the frontal, and it's normal. Then the maxillary, and I don't feel any abnormalities. And now I'm gonna assess the ears. So I'm gonna inspect the auricle, helix, tragus, and lobule. And I'm gonna note for size, shape, position, observe for any lesion, discoloration, or discharges. And to the other side. I don't have any otoscope, but if I have an otoscope, I will inspect the external auditory canal for any color discoloration and any discharges, nodules, and cerumen. Next is palpate the ears from back to front. And then, under the chin, onto the anterior triangle for the anterior cervical lymph nodes. Next is palpate the left and right carotid arteries. Do you feel any pain?
No.
Then next is palpate the trachea. Do you feel any pain?
No.
Palpate the thyroid gland to identify thyroid enlargement, tenderness, or nodules.